Hello and welcome. Kerry here from Healing Humanity, the Power of a Proper Human Diet. And today I'm thankful, grateful, blessed to welcome Dr. Suresh back to the channel. Dr. Suresh, how you doing?
Very good, thanks, Kerry. How are you today?
I'm doing wonderful. It's pretty cold out. It looks like you're in a nice, warm sort of area. How's the weather by you?
Yeah, it's really nice, actually. I was just saying off there, it's a bit echoey because I'm stuck in like a little office. We're on holiday at the moment, and there's a really nice view out the back, but my family's going to get home any moment, kids, and just start screaming, and it's going to be terrible. So I figured I'd stay in here for the time being. But no, it's really hot at the moment. It's been raining on and off pretty heavily for the last week or so, but it's sunny now. We're at the beach. We're happy.
Nice, beautiful. Yeah, I know how it can be working with kids around. It could be tough sometimes, but looking forward to chatting with you. For everyone that's jumping on right now, this is going to be fun. We're doing a little bit of different format with live streams lately. We have several things we're going to be giving away tonight throughout the live stream. So if you have any questions for Dr. Suresh, please post them with the QQQ. And then maybe I'll just show this real quick before we jump in as people are still jumping on here. This is what we've got going on. I'm going to share this here. How to play. So I'm going to be giving away, we have our Healing Humanity membership site, and we've got some Redmond salt shakers. So we got the membership site and the Redmond salt shakers. So we're going to be giving away a few of those tonight. It's really simple. The only thing you have to do is post a question in the sidebar for Dr. Suresh or a comment, and you have to use a hashtag. So the first one we're going to be giving away is the Redmond salt shaker. So if you just use hashtag salt along with your question or comment, we're randomly going to pick one, and we're going to do it throughout the night. When we're going to pick one for the salt in a little while, and then we'll do one later for free 1-month membership to the Healing Humanity website. So post some good questions for Dr. Suresh. Looks like we got a bunch of people jumping on right now. Bill Knott, Papa Carnivore, Karen from Texas. Hello, everyone. Yeah, so Dr. Suresh, if we could, and just for all of those that are watching, I have a link to Dr. Suresh, your YouTube channel and website in the description below. That's part of the giveaway too. So follow Dr. Suresh, ask your question with the hashtag SALT, S-A-L-T, and we'll pick a winner. Dr. Suresh, if you don't mind, could you maybe share a little bit about your background, I guess both professionally and then maybe also everyone's interested in the personal carnivore story. So you're, of course, a doctor, but you're also a practicing carnivore. So maybe if you could touch on both of those things.
Absolutely, Kerry. So yeah, first off, let me apologize. It is quite echoey where I am because we're on holiday. It's in this office. There's nothing here. It's just an empty room, basically. So I can't do much about that. I apologize. But yeah, I mean, basically my personal and professional story, I think is actually it's very much intertwined. And I think anyone in this kind of, low carb, keto, carnivore space, anyone that's not doing the standard stuff, like on YouTube they often have that personal and professional story intertwined. And is my audio okay still?
Yeah. Yep.
Okay.
Good.
And basically for pretty much all my life, I've been overweight, unhealthy ever since about the age of pretty much as early as I can remember. Honestly, I was just unhealthy, overweight, and was always unhappy, with that. And over the years, of course, done every diet going, vegetarian, vegan, for one meal, that was terrible. Low carb, keto, intermittent fasting. I'd done everything and nothing ever really stuck. They all worked for a short time, and then inevitably things don't work. And I was always the loophole guy, just addicted to food, addicted to sugar. And then over the years, just getting slowly more and more unhealthy, like a 2 steps back, 1 step forward kind of deal, I'd lose some weight and then put it all back on. And then inevitably I just kind of keep getting bigger, keep getting more and more unhealthy. And then eventually, I'd kind of just like given up with myself. And I look back at photos now, and I just think, like, how the hell did any patients even trust me? Because I was giving out weight loss advice, and I was like, My BMI was probably close to 40. Like, how the hell were people even listening to me? Why would they even listen to me? Like, I have no idea. But I'd given up with myself, really, because it was just too hard. I just couldn't do it any longer, and resigned myself to just medications and that life that I saw for all my patients. And then I actually found the carnivore diet, went to Low Carb Down Under here in Australia in 2022, heard Dr. Anthony Chaffee talk. And then it just kind of, something just hit me, you know, and I'd heard about carnivore diet a couple of years prior, had a patient who'd done it, amazing benefits, but yeah, my mind was still stuck in that, just like, no, carnivore's bad, like cholesterol, it's going to kill you. And I remember saying to this patient, like, this is going to kill you. Like, dude, come on, like, you're going to die. And of course he didn't, and he saw lots of benefits, but I couldn't bring myself to do it or endorse it in any way. And then I heard Dr. Chaffee talk, and something just clicked. And, oh, you know, well, maybe now, like, there's a doctor talking about this. Like, maybe this is okay. And I had no idea at that point, you know, who you were, like anyone like Sean Baker, Ken Berry. Like, I had no idea about any of these people. Somehow, even though I was into low carb and keto, I wasn't aware of any of these people. Nobody was on my radar, really. And so I just decided to come home, try the carnivore diet, and then just within, like 36 hours, basically just felt incredible. Better than I'd ever felt before. And obviously I hadn't just lost like 30 pounds overnight, like, no, but I felt incredible at that point. And something just was like, this is different. Like, this is real. Like, I'm not just losing weight. Like, I actually feel good for the first time in probably 20 years. I actually feel healthy. Like, my pain is gone. I'm clear-headed, and I've done keto, low carb, fasting, and yeah, you'd get all those benefits, but this just felt different. And then that was kind of just the end of it. Like, I just haven't looked back since. And then I started taking it to patients, and then I started, you know, I kind of came up with a podcast and was like, oh man, like, I've got to tell everyone, like, nobody knows about this. This is incredible. And then I start researching it, and then I find out, of course, like Dr. Chaffee, Dr. Berry, Dr. Baker, and all these other people. And I'm like, oh, okay, like, actually everyone knows about this. I'm just really late to the party, but maybe I can add my voice to it anyway and be an advocate for my patients, at least, that maybe don't know about this. And so I started taking it to my patients, and, you know, probably like with anything, you think you found the magic cure, you get a bit zealous with it. And but people generally responded to it fairly well. I found it wasn't that hard of a sell for men. Men were like, I'll just do it, that's great. Women were a bit more like, I think I need vegetables, you know. So but, you know, over the last couple of years, I've been working with patients with that carnivore diet, anything in the, honestly, like animal-based all the way through to strict carnivore, whatever they want to do at the end of the day, it's all within that sphere. And I've seen just the most amazing benefits from people following this diet, from myself following this diet. And basically it's just been a really incredible journey. That journey is not over by any means. And I just want to keep helping patients as best I can to try and live a life ultimately free of disease, or at least as disease-free as possible, to try and have minimal pain, to try and have maximum quality of life, and ideally quantity of life. You know, I think we can have both. And sadly, you know, you look at all the stats, I mean, chronic diseases are just skyrocketing all the time. Cancer, heart disease, diabetes, obesity, they're all just skyrocketing. We are totally losing this. Well, it's not even a war, it's just a bloodbath, you know, like we're just losing this so badly as doctors. And what we are doing is just not working. And because we've just got it the wrong way around. And as doctors, you know, we're in this system, this medical system, where we're prioritizing medications, we're prioritizing interventions like surgeries to fix the problems after the fact, rather than actually stopping them in the first place and preventing them in the first place, which probably 90% comes down to diet. And the carnivore diet is just, I think, a really pretty optimal human diet. And I think if you're following that optimal human diet, you're really not going to go that far wrong, to be perfectly honest. So this is what I teach my patients now. This is what I teach people. And if they're open to it. If they're not open to it, that's fine. I don't force it on them, of course. But I just tell them I use my personal anecdotes. I use my patient anecdotes. I use my personal story to show them that that there is a different way of doing things, and ultimately, why not try things? See if it works. If it doesn't work, what have you lost? If it does work, amazing benefits potentially.
Right. Are you seeing any other colleagues or doctors that you work with adopting more of the nutrition, addressing the metabolic health?
Yes. I mean, slowly. Difficult to know, because like anything, you go on social media, you start posting stuff, you start looking at stuff, it shows you what you're looking at. So then you start seeing more posts from other people within that same sphere. But I think just broadly, like I do feel like there is a movement towards getting healthier and trying to prevent more chronic disease, and a move towards nutrition. Within my immediate vicinity, like my practice and so on, where I work, people try, but I think most of the mainstream doctors either just don't really know what to do, because we get really no nutritional training at all, and that always surprises people. But they also there is probably an element of burnout, in the sense of, I'm sure they do tell patients, like try and be healthy, try and exercise, try and do the diet, etc. But often it just doesn't work, because they're probably not giving the right advice or setting the patients up for success. Ultimately, then of course it fails, and so they inevitably just stop telling people, because in their mind it just doesn't work, and so just do the meds. The other thing there is, I think, like as a population level, I think a lot of doctors look at it as a population. They say, right, okay, well, I have 2,000 patients. What's going to give the biggest bang for buck? What should I focus my time on with those patients, knowing that the majority probably aren't going to respond terribly well to those lifestyle changes, partly because they're giving the wrong advice. But I think that's also why a lot of doctors do just default to medications, because that's probably going to give the biggest bang for buck, so to speak, amongst their population of patients.
Right. Yeah, it's a tricky thing. When I first started this, I'd give doctors a really hard time. And then I had some good doctors on the channel that were like, wait a minute, listen, like I have talked about diet to 100 patients and none of them listen. So then I'm like, well, I get that point. It's really a tricky thing, because for me, I never would have imagined in a million years that my depression and anxiety was nutrition. I thought that was something in my brain. So it's a tough thing. I get it from the doctor's perspective. If they just keep talking about the same thing over and over again, if people don't listen, it's almost like you got to have that awareness a little bit, and then the individual has to take responsibility. Because I imagine a bunch of them.
Yeah.
You tell 100 patients, and maybe one of them is going to listen, kind of thing.
Yeah, you do. I mean, obviously, a lot of the work that I do now, I'm getting more patients who are interested in being healthier. So that is very much skewing towards people do want to listen. But yeah, I mean, I try and approach it just every patient's just like it's a reset. Every patient is just a new patient at the end of the day, and it's hard mentally to not carry over from other patients, but I think you owe it to that patient to try and give them the best advice, and if they don't take it, they don't take it at the end of the day. But yeah, it is hard, because a lot of people don't want the advice.
Right.
They don't.
And some of them are so addicted that it's like trying to tell an alcoholic or something, yeah, just don't drink anymore. Like, okay, well, we'll listen to that.
It is, but I also think a lot of patients, a lot of people are burnt out, because they've been there and done that. At the end of the day, they've probably tried every diet going, and apart from maybe a carnivore, or an animal-based diet, and nothing's really ever worked for them. So in their mind, they're like, why would I listen to you? Because it's just another doctor telling me that my problems are what I eat, but nobody actually offers me any real solutions. In their mind, why is it going to work? Because I've done it a million times before, So you got to try and convince people, and that's where I think that personal story actually really does help. And I think that's, I often say, like, there's no mistakes as long as you learn from them. And my personal health journey helps me to be a better doctor to my patients, I think.
Yeah. Yeah, I think that's huge. Just the fact that you've kind of been in my shoes and you're practicing what you're preaching is big. A lot of the doctors I've had over the years, I'm like, you're giving me diet advice and overweight, or they have issues clearly themselves. So it's like, if you
Yeah.
can't, if you're not practicing it, it's hard to take that real. But
Yeah. That was me. But you know what's really interesting though is I probably get far more comments now than I used to on my weight from patients. And actually sometimes, you know, people say to me, but like, how do you know? Because like, look at you, like you're slim. I mean, I've still got a lot of weight to go, but like with my shirt on, they're like, but you're really slim. Like, how can you possibly know what it's like to try and lose weight? So I end up showing them old photos and they're just like, oh my, like what? Like, oh my God.
right.
Like, okay, maybe I'll listen to you.
Right. That's powerful right there. Just have that, just pull the picture out. Cause yeah, I mean, that's why with the YouTube stuff I'm doing in the documentary, it seems like that's the only way people really want to change is if they see another person that's gone through it or done that change already. It's a lot easier to get inspired from that. Well, Dr. Suresh, we have a whole bunch of questions firing through here right now. So if you don't mind, maybe we'll take a few questions.
Sure.
Real quick, Terry, May, Luis, and Andy, thank you. New members, really appreciate that. Every penny we get from those memberships is going towards our documentary. We have a question on electrolytes. Any thoughts why electrolytes might suppress my appetite? When I take electrolytes, I seem to eat less.
I suspect that's because hunger is driven by a number of things. You know, if we're hungry, it means almost certainly the body wants something. And if we're not hungry, the body's pretty happy. That hunger can be, it can be thirst, first of all. You know, sometimes the body gets a bit confused, or we actually get a lot of our fluids from the food we eat anyway. So it could be thirst. But hunger really is or cravings, maybe we could call it cravings as well. I think that also aligns, is the body telling you, I want something. And that could be energy, call it calories or mass or energy, whatever you want to call it, just, you know, physical kind of food, sustenance. It could be macronutrients, protein, fats, potentially maybe carbs, though maybe not likely. And then micronutrients and things like minerals, vitamins, electrolytes. And so if your body actually wants some, let's say sodium, for example, because your sodium is dipping, it's going to drive a hunger signal for you to go and eat something because it wants that micronutrient. If you can replace that micronutrient anyway, then that drive, that signal disappears, assuming that's the only, you know, signal it's kind of sending. And so then your hunger is going to go down. And I certainly noticed this, you know, when I really go like zero carb, for example, like my sodium starts dropping a little bit, my cramps start to come back a tiny bit, and then my body's just like salt. Like I just crave salt like crazy. But then, you know, put salt on food, and like I really need some like food, and I put loads of salt on my food, and then the craving just goes, the hunger just disappears because my body's got what it wanted. So I think that's probably why that's happening.
Good stuff. Thank you. For anyone that's jumping on right now, huge shout out, Dr. Suresh, for joining us. There's a link in the description below so you can subscribe and follow everything Dr. Suresh is doing. And if anyone wants to get entered to win, it's hashtag SALT. Even if you don't have a question, you can just put that with a comment in the side. We're going to be doing that drawing just here in a couple minutes, giving away some free stuff, making this a little bit more fun for everyone. Question: if you had your large intestine removed and you're on a strict carnivore, wouldn't you have to supplement?
Oh, that is a really good question. Probably just in general, though the large intestine doesn't really have that much as far as absorption. You know, most of it happens in the small intestine. I'd have to, you know, research that one to be 100% on that. But I don't think you'd really have to supplement overly. I can't think of anything specifically that's really absorbed overly in the large intestine other than water. So yeah, I don't think you'd really have to supplement specifically for the carnivore diet, just maybe just a bit more in general. Yes, it's probably not a bad idea.
Right. Helena, hi there from Wisconsin. Does it seem normal to have more brain fog in the beginning, even if I feel good otherwise?
Yeah, I mean, that's pretty common. I mean, people talk about the keto flu. Of course, I'm sure you've experienced this, Kerry. I'm sure lots of people out there have as well. And it's you know, it's really just your brain just getting used to that transition, the changeover into using ketones predominantly. You know, it's not the best analogy, but it's like changing, you know, your like petrol car into diesel or something. I mean, or maybe, you know, gas like you guys use in America. Just changing the fuel source, basically. Like there's going to be a changeover period, and there's going to be some issues with that changeover. And different cells in the body are going to respond differently. When the brain's just used to primarily running on glucose, if you've been eating carbs all the time, then you know you're going to have some issue. The other thing we mentioned earlier, of course, is electrolytes. That also makes a big difference as well.
Yeah. I went through that a little bit.
Normal.
Right. I went through that a little bit, and I always tell people, just if you're brand new to this, just keep in mind it's very temporary. This isn't like your whole carnivore journey, right? You might just have a little bit of the keto flu in the beginning. When I went through it too, I'm like, listen, I destroyed my body for 42 years. There's all sorts of toxins and garbage, and now I'm switching fuel sources. So there's going to be a little bit of suffering. But yeah, if you keep up on the electrolytes and drink a lot of water, it doesn't last too long.
Yeah, it usually goes, yeah.
Does the carnivore diet help with periodontal disease?
Yeah, I'm smiling because yes.
Helps with everything, right?
It kind of does help with pretty much everything. But yeah, specifically periodontal disease, actually, yes. I've spoken with James, I can't recall his name now. I've spoken with him previously. He's been on like Dr. Baker's show. He was vegan, you know, for pretty much like 40 years. And then went carnivore and saw amazing benefits. And one of the benefits he spoke about, I also saw, was fixing his impacted wisdom teeth, which is really interesting. And I have 2 impacted wisdom teeth at the bottom as well. And I used to just get continuous infections around this one on this side. This one's not exposed. This one was partially erupted, so it will just always get infected bits of food and everything. And it just always hurt. And I was repeatedly on antibiotics for it. And then when I went carnivore, almost like just stopped happening, just completely disappeared. All the inflammation went down. I went back to my dentist, I think about maybe 3 months after starting carnivore. And I was nervous. I was actually really nervous because all the tartar was just like falling off my teeth. I honestly thought like my teeth were going to fall out or something. I didn't know what was going on. All this just like crunchy stuff coming off my teeth. And I went to the dentist and I asked him to do an X-ray. He said, everything looks great. And I said, look, can you just do like an X-ray just to see what's going on? Because I basically had essentially abscesses, you know, just inflammation and abscesses really around these teeth. And he did the X-ray and he was just like what? Like, what the hell has happened? Like, they're just like gone. Like the inflammation's just gone. Like the abscesses are basically gone. And he said, your teeth are also not as impacted. Like they're actually moving into where they should be. Like, what have you been doing? I'm like, I'm on a carnivore diet. Like I'm just eating meat, like no sugar, no vegetables, no fruit, like nothing. I was pure meat at that point. And so all that periodontal disease just disappeared. The impacted wisdom teeth started moving back to where they should be. They're still slightly impacted, but they're getting better. And I noticed if I do go a bit on the carbs, like straight away, my teeth just inflames again straight away. Just go back to just almost 99% meat and it just disappears again. So yeah, a long way of saying, yes, I think it absolutely can help.
Yeah, it's really interesting. I had Dr. Kevin Stock on, and one of the questions we talked about was, would you even be a dentist if everyone ate a proper human diet? And he's like, other than, you know, like if you chip your tooth or something like intervention, you wouldn't need it. He's like, braces, cavities, like all, it'd be all, none of it. You wouldn't need any of it. It's really kind of sobering when you think about the amount of money spent on dental work and all these other things that would be completely avoided if we were just eating a proper human diet. I noticed the same thing too, by the way. That was very noticeable when I started carnivore. I used to get toothaches all the time, and my gums were always bleeding. There's inflammation in there. I went to a dental appointment shortly after starting carnivore, and it was a similar conversation where she was like, "What are you doing?" Like, she said, everyone I look at, they got bleeding gums, and she said, when you have inflammation, you can see it in your mouth, and if it's in your mouth, it's in the rest of your body. It's everywhere else, sort of thing. It's something that she saw all the time, like getting worse and worse. Like everyone's coming in, it's just inflamed like crazy now. So, question from Aid Larson. There's more and more funding for cancer and disease, yet the problem is getting worse. Where does this money go?
That's a good question. I mean, I don't honestly know, the answer to that. Obviously, a lot of research, drug development, and so on. But it's a really good question. I don't know, obviously, the specifics of where all the money goes, but doesn't seem to be working, I think is, the answer. I guess that's a bit of a rhetorical question from Aid, but basically we're not winning, we're losing hands down. It's not even a battle. It's a bloodbath.
I encourage people, like, if you want to donate to a cause, Professor Thomas Seyfried, he's been talking about cancer as a metabolic disease for like 30 years now, and his lab is doing some incredible research, and a lot of it's I think just funded from people donating money or whatever. So if I were to donate, that's where I would go. And we've interviewed a couple individuals with cancer for the documentary, and that was kind of their thoughts too. It's crazy. He's been working on this stuff for 30 years now, talking about cancer as a metabolic disease with metabolic treatment. So
I mean, I was just on that subject. I came across an Instagram reel. I haven't fact checked it or anything, but it was this guy, ex-pharmacist, ex-chemist, talking about interviews with drug companies and them just being completely open with him and just saying, like, we don't fund cures. Right. That's not our business model. Like, it's just, and that's the thing. Like, that is ultimately the world that we're living in. These companies, it is genuinely a patient cured is a customer lost, like that's the meme, but that is kind of the way that the system works. It's shocking, but that is it.
The thing I learned from Professor Seyfried that was kind of blew my mind was just that many I'm not an expert. I don't know. I'm not putting words in his mouth, but it seems like so many people are getting cancer now because of chronic systemic inflammation for years and years. And most of us have chronic systemic inflammation from eating all this crazy food that we were never intended to eat. Of course, you can get cancer from smoking cigarettes and there's many other environmental things nowadays too that could cause it. But I don't know, after we interviewed him and 5 people on his team and several others for cancer. And it just seems like the further humans get away from what is natural, the more cancer rates are going through the roof. So
absolutely. It's all about just, damage, like damaging that DNA. It's so fragile, and but we do have the systems to repair it in the body, but a lot of those systems then get turned off with what we're doing to ourselves as well. So we're getting more damage, and we're turning off those repair systems. And the whole thing about cancer being a genetic, disease, like there's not really any inherited genetics that I know that are really actually linked. There's a couple, like maybe BRCA mutations in breast cancer, for example, but there's not many. And yet these cancer rates are just completely exploding. I mean, like bowel cancer in in young people, it's just completely exploding.
Right.
And actually we know what causes this. It's the diet and it's the environmental toxins. And I was reviewing a study the other day because I'm putting an episode out on this very thing, bowel cancer in young people soon on my channel. And it was basically saying, like, the problem is the diet. And it's things like artificial sweeteners, like these are very much linked, and sugar sweetened beverages, like fruit shoots and stuff like that in kids. There's a really strong association. It's not causation, no, but there's a really strong association there with sugar sweetened beverages as a child, and then bowel cancer development as a young adult. And we know these things exist. We know the causes, but it's all just kind of like covered up a little bit,
Yes.
I don't know.
That's the crazy thing too, when we talk about, like, where's all the money going for cancer or to curing cancer. And it's like, if it's caused by lifestyle and diet, it's like you're hitting yourself in the thumb with a hammer every single day. And it's like, give me a cure for hitting myself give me some medicine for this. Like, don't just stop hitting yourself with the hammer. And it seems like a lot of the money is going to try to find a medication for that, when it's like, no, people, you just need to understand this is your escape from what is natural. You're putting this food into your mouth, and you're eating these things that are causing inflammation over and over again for years and years. Question: is it possible to heal MS with the carnivore diet? I don't know if you have a point on that, Dr. Suresh, but I'll just say real quick. Heal's a strong word. I don't know, but I've had 2 individuals on recently that have just seen remarkable turnarounds with MS in terms of all the symptoms they were having. And then my friend Dave Mack, I think he's interviewed 5 with MS. And one of them, interestingly, had like lesions and had a scan before carnivore, and the lesions going away on their scan after carnivore, which is just fascinating. But again, this is a handful of people. But I don't know if you have any experience with MS and carnivore. Any thoughts on that, Dr. Suresh?
Yeah, I mean, I was going to say heal is a strong word. Cure, I wouldn't go that far, but improve, certainly there is evidence to support that, absolutely. I've got an episode coming out soon on my channel about autoimmune diseases and ketogenic diet, including MS. And yeah, there's loads of studies basically showing that ketogenic diet, carnivore is essentially a ketogenic diet. That ketogenic diets can improve MS, improve repopulate, the myelin sheaths, and actually heal some of these problems. To what degree, may be variable with people. But then, of course, carnivore is even one step beyond keto. Keto, of course, the main benefit is that ketogenic state, the beta hydroxybutyrate floating around, all those lovely keto bodies that we want, and the anti-inflammatory nature. But a carnivore on top of that then gets rid of all of those plant toxins, things like oxalates. Of course, people like Sally Norton talk about oxalates, of course, being neurotoxic, and damaging. And I've had patients with things like MS, go on a low oxalate diet, and they have improved. I mean, not cured, but they have improved. And they haven't even gone keto, they've just gone low oxalate. So I think you combine all of these things, and that's what the carnivore diet really, I think, does for people, is it kind of combines all of this stuff. Getting rid of the environmental toxins, getting rid of getting into ketosis predominantly, and getting rid of the plant toxins. You combine all of that together, I think you've got a very powerful combination for healing.
Absolutely. All right, let's see. Question: is it normal to have calf and plantar fascia cramps? Been carnivore 15 months, take plenty of electrolytes every day and Lugol's iodine daily. Cramps come at about 4 a.m.
Yeah, cramps are tricky. I think that's all I'm going to say. I mean, I'll expand on that, but cramps are tricky, and I'm still trying to work out the cause really for cramps. And cramps, I remember a conversation I had with Dr. Paul Mason offline, a while ago, and we were trying to help each other, almost trying to sort out patients with cramps, and we really kind of came to the conclusion that it's just really tricky. Cramps are down to the ATP production predominantly in the mitochondria, and there's so many factors that go into that, sodium, potassium, magnesium, calcium, boron. I'm a big fan of boron. And the other big one is hydration. And I think the hydration, everyone focuses on the sodium as far as carnivore is concerned, and may potentially forget about the hydration. I mean, I had some pretty bad cramps the other day. I get them in the front of my shins really badly. And most of the time for me, it's not a sodium issue. It's actually a hydration issue. And I just pretty much pounded water. And then the cramps went away pretty quickly after that. And sodium will help to kind of retain water as well. So it's not always a sodium issue. It's the balance. It's the balance of those things. That's the hard part. So cramps it's a lot of trial and error. Actually, it's not a one-size-fits-all approach. So it's really difficult to give advice on getting rid of cramps.
That's some good points, though. It's interesting because we always focus so much on electrolytes. And I was actually having the opposite issue where I was chugging too much water and kind of diluting the electrolytes. I had my blood work done, and my sodium was low. And I'm like, this is crazy. Like, I consume a ton of sodium. And then I realized it was because I think I was just diluting it. Like, I don't know why. I just always drank way too much water. And so when I cut back the water, but to your point, I guess on both ends, there could be a balance between hydration and electrolytes. Question from Aro. How long did it take to get off anxiety medications after adopting the carnivore diet? For me personally, 3 weeks into carnivore, I felt absolutely incredible. But I'm always very cautious with this because everybody's different. And I was doing ketogenic diets on and off. So I think it happened for me quicker. My biggest advice for people, Dr. Suresh would probably agree, is whoever prescribed that medication to you, you need to go back to and you need to get a plan with them to get off of your medication. It's different for everybody, but it can be incredibly dangerous to stop those medications or alter your prescription on those medications. So I guess that's my best advice. Like I said, it could be different for everyone. I've talked to quite a few people. I don't know if you have any experience with this, but I've talked to quite a few people. Like around 3 weeks, their anxiety isn't gone, but they have a whoa moment where like, I feel better now than I have in a very long time. And I had that too, but my anxiety wasn't completely gone at that point. It still took a little while after that. So.
Yeah, I think the first thing to say is exactly what you said. You know, get a plan for getting off the medications, because some of these can be really harsh to come off. Not dangerous, but just really harsh to come off. Depending on what you're taking, if you're on like benzodiazepines like Valium, for example, Xanax and stuff, like they can be dangerous to come off if you're on high doses. So the first thing is get a plan, and then the second thing is I've seen patients anywhere from maybe 4 to 6 weeks getting off, or at least vastly maybe looking at reducing their medications, and noticeable improvement often within a week or two. It really can happen pretty quickly on the carnivore diet. It really is quite powerful, and there's a number of reasons why that can happen. But the other thing I want to add there is it doesn't always work, and I think this probably comes down to what is really driving that anxiety. Because if you've got other things in your life that are really driving that anxiety, you're just in a pretty bad situation financially, or relationships, work problems, bullying, stuff like that. Like your diet might help. I mean, you might get a little bit less stressed. I talk about carnivore gave me this like stress shield. It felt like everything bounced off me and didn't bother me anymore. But if there's big issues going on in life otherwise, they also need to be dealt with, of course.
Yeah, absolutely. All right. Real quick, I'm going to do a quick little drawing here. It's going to take, for everyone that posted a comment or used the hashtag share, we're giving away a Redmond's travel size salt shaker. All right, so here we go. We're going to randomly pick someone. So if you win this, just shoot me an email, homesteadhow@gmail.com. Got a ton of people posting, so let's see. It's going to end up picking me. Cranky Carnivore Cutler. Congratulations, Cranky Carnivore Cutler. Shoot me an email, please, homesteadhow@gmail.com, and we'll ship out to you Redmond's travel size salt shaker, which we were just talking about. So there we go. So we're going to do one more of these real quick. We have our membership site, which we're very thankful Dr. Suresh came on the other day as one of our doctor experts. We've got Dr. Baker coming up in just a couple weeks, and Dr. Kiltz coming up as another expert. So we're giving away 1 month free if you use hashtag community. Post a question here in the side chat with hashtag community, or just post a comment, or just post hashtag community, and we'll pick someone for one of those too. So, but we do have a couple other questions here. Question from Polish Mike. Why do many people decide to introduce carbs in to create insulin bump? Wouldn't eating more protein be equally effective and healthier, since you provide more nutrients than from any carb?
It's a very good question. And as someone who has introduced a little bit of carbs here and there, maybe that might be one, maybe perhaps more for me. Honestly, the answer is I don't know. It seems to act differently. I couldn't really give you exact numbers on how much the insulin will jump up from protein versus carbs. Protein is going to have a lot less of an impact than carbohydrates. And so that's maybe why people choose to add in that little bit of carbs to give that insulin bump, just because it's a little bit higher than the protein. You probably have to eat a lot of protein to significantly increase your insulin, to the point where things like, cramps, like, holding on to sodium, potassium, insulin going up, aldosterone going up because of insulin going up. I think you'd have to eat probably a ton of meat. And when I say a ton, I mean probably more than like a kilo of meat. You probably have to eat a very significant amount of meat versus say like 20, 30 grams of carbs. So maybe in that sense, the carbs are just easier for people. You know, I don't know. Of course, some people just want to eat carbs, you know, as well at the end of the day. But, you know, yes, if you probably could eat enough protein, that would probably give you the same benefits or the same impact, maybe, shall we say. But I just don't know if it's actually physically possible to eat that much protein in one sitting.
All right. Question. Have you had any success in treating POTS with carnivore diet? Been carnivore for 9 months without success.
Maybe that's a question for me again. Yes, but there's a tentative yes. And this is where, again, POTS is a really challenging condition. I'm sure, you know, Bern Schwag probably knows that if they've got POTS. And it's a very challenging condition, and it's often very much down to the balance. Sodium seems to be one of the biggest problems with POTS. They would just really struggle to hold on to sodium. So the carnivore diet, when I say carnivore, like a strict zero carb, I'm going to maybe break it down a little bit. So strict zero carb, you can have a lot of issues holding on to sodium, which in my experience with patients with POTS tends to make things even a little bit worse, that really strict zero carb carnivore, because the body can have more issues holding on to sodium. Now, if you just simply replace all that sodium, you're probably going to be fine. The problem is with POTS is often the balance of sodium is just up and down all over the place. So it's really hard for the body to regulate for whatever reason. You completely get rid of the insulin and aldosterone, you know, that makes it even harder. So I've actually had a bit more success with POTS with what I would call a non-zero carb carnivore. So maybe like 20, 30, 40 grams of carbs a day. Still sticking to the carnivore principles. So getting rid of all the plant toxins, you know, getting rid of environmental toxins, and still very much in that kind of ketogenic space. But maybe just not 100% zero carb carnivore, just that very, very, very low carb ketogenic, more of a ketovore, if you will, type of carnivore. So it may be worth trying that to just see if that has a little bit better ability for the body to actually hold on to the sodium, which tends to be the really big problem with POTS.
All right. Question from, this is my buddy Alex, Carnivore for Life. We just filmed Alex out in the UK. He's got an incredible story. Just got blood pressure readings yesterday, 200 over 181. Got home 150 over 80. GP pushing BP amlodipine immediately, resisting thoughts.
Yeah, I mean, first off, obviously, this isn't going to be direct medical advice, so disclaimer there. I mean, I'm glad you managed to get home. I mean, a blood pressure of 200 over 181, like I'd probably be calling the paramedics, honestly, to be getting this guy to the hospital, because that is very disturbingly high. But obviously, you know, it was fine. I mean, look, a home BP of 150 over 80, it is high. The diastolic is arguably more important actually than the systolic. That's the lower number. So the systolic is that first number, diastolic is the second number. That's arguably actually more important as far as general health is concerned, because it's what the body's kind of doing a bit more at rest. Whereas that systolic, the first one, is what the body's doing when the heart's actually actively pumping. But it is still a bit high, that systolic 150 over 80. Maybe I could say how I would approach this. Again, just generic advice, but if I had a patient with this blood pressure, if it's genuinely 150/80 at home, that is high. So we need to take steps to manage that. I wouldn't be necessarily rushing in straight away with medications, but I give people the options. I'd say, look, you can either go down the medication route, and amlodipine, as long as they're not allergic, is perfectly fine, depending on their age and local guidelines and so on. Or you can try and fix it with lifestyle. Or maybe both if you want to. Let's get it under control and then make the changes at the same time, and then eventually maybe 2 or 3 months down the line, stop the medications. But I would be saying to this person, look, what do you want to do? Like, how do you want to proceed? You've got to get this down. It's just, how do you want to do that? How is best placed to do that? And the medications, they can help with a number, but they do help with the risks of that number. but they don't often help with the underlying reasons, which almost always is a metabolic syndrome and insulin resistance. And the tablets don't fix that. They just lower that number, which does lower the risk. But when you look at things like, you know, heart disease, for example, hypertension, high blood pressure is about, if we look at the Women's Health Study data, you know, which is applicable to most people, even though it was in women, it's around, I think hypertension was around 4.5, something along those lines, 4.8, whereas metabolic syndrome was like 6.5, 6.8. So, and the metabolic syndrome really drives the high blood pressure almost always. So by treating the high blood pressure, yes, you're dropping the risk for heart disease and stroke, but you're actually still leaving the metabolic syndrome on the table. And actually, it would be better to try and target that to then treat the blood pressure. Does that make sense?
Yeah, I think so. The tricky thing with Alex is he's incredibly healthy. Like, he lost a bunch of weight and he looks so much younger than he was before. I wonder, like,
yeah. I mean, I would repeat it. That's the first thing that I would say.
I was just going to say, like, I wonder if he was nervous or something to do the numbers up, or how has it been in the past, Alex? That'd be another question. Is this like way out of normal range for you for getting your blood pressure tested? And then like maybe other tests too, what, the CAC score or something like that? Maybe, I don't know if you're.
Yeah, I mean, it's useful to investigate around it, obviously, but you know, just like a high blood pressure is just a risk factor in itself, so it does need to be addressed. It's just, is it actually a genuinely high blood pressure? And yeah, the first thing I would do is say, right, okay, just take it twice a day for a week or so. That gives you 14 readings. Average all of those out. Just put them into an Excel spreadsheet and just be like, click average. You know, easy, simple, and it'll give you the average. And if it's below 135/85, it's generally seen as acceptable for a home blood pressure, though, you know, lower is generally better. And that's the first thing that I would do. And then if it is high, then yes, we need to make some changes.
All right. Nancy said, how much salt is too much? Can it cause hardening of the arteries?
I'm not aware that there's any risk that salt can cause any hardening of the arteries. Maybe it's a good point to clarify, though. You know, hardening of the arteries in and of itself is problematic. Hardening of or calcification of plaque is probably actually beneficial, because we don't really want soft plaque in arteries, because that's a risk of rupture and then, you know, blocking thrombosis and blocking the arteries, strokes and heart attacks. I'm not aware that salt is really any particularly increased risk there. That's actually really been demonstrated in randomized control trials, for example, other than, you know, association of processed food with calcification of arteries and reduced elasticity and insulin resistance. But then, is it the salt in the processed food, or is it the processed food and the seed oils and the sugar and all those other crap that they put in? It's probably not the salt.
Right. All right. Let's see here. Oh, I guess this isn't a question. It was Kerry's daughter who convinced me I needed to give carnivore a serious try. She went on a rant while riding it. That sounds like me. She went on a rant while riding in the car with Dad and made so many excellent points. I think she's talking about your daughter, Emma. That's awesome. Thanks for that, greatest ever. I'll let Emma know that her little rant encouraged you, inspired you. Dr. Nelson, member for 8 months. Hello, Kerry and Dr. Suresh. Hello, Dr. Nelson.
Hello.
Sherry Morgan, question: do you notice a difference with histamine intolerance when eating beef versus lamb on Lion? Thank you.
I don't have many patients on the Lion diet, so I'm not sure if I can overly speak to that. Other than a lot of people eating beef will maybe eat like ground beef or mince, which tends to be a lot higher in histamine. So I don't know what your experience is on that, Kerry, speaking to people.
Yeah, I haven't had issues with histamine myself. I've done a little bit of Lion and carnivore, so I'm not sure. The one thing I would suggest maybe, Sherry, is my friend Lynn, Midlife Carnivore. She's got some really good videos on histamine and histamine intolerance. So maybe check out her channel. She really digs into some of that stuff more. All right. Let me see. We got one more here. There we go. I think we got through. Sorry, that was like total turbo round of questions there. You knocked it out of the park. Thank you. I think we got through most of the questions. If there's any other questions, please shoot them over quick. So, Dr. Suresh, do you have anything coming up on your YouTube channel or anything exciting you want to share?
I've got some pretty good stuff actually coming up soon. So I've actually got an episode coming out tomorrow. So Monday morning in Australia. That's tomorrow morning. Basically talking about how about my gaming addiction and how the carnivore diet, kind of finally helped me get rid of that gaming addiction, which I think is a pretty powerful video. And that's been in the making for some time, and I've wanted to talk about that properly for some time. It's just taken fair bit of courage to book up to actually put it out there. So that's coming up tomorrow, which I think is going to be a good video. And I'm sure there's going to be people out there with similar addictions. I know you spoke about benefits there from carnivore diet as well. Otherwise, I've got some great episodes coming out soon, looking at studies, ketogenic diet, how it protects, against cancer, ketogenic diet, how it protects against autoimmune diseases, how, the gut microbiome is changed from, ketogenic diet, how keto can help reduce risk of strokes, and all sorts of stuff coming out soon on my channel. So I'm starting to look a little bit more at like studies and things with just a little bit more scientific basis, I think, because these are really powerful. The more studies and things and more evidence we can get out there into this space, I think is really powerful. Because I think one of the biggest criticisms of perhaps of keto and carnivore, maybe certainly carnivore, is just it's all anecdote and it's not enough evidence. I think anything that we can throw out there as far as evidence and decent quality evidence, and I'm actually looking at the studies and then saying, like, is this actually a good study? As opposed to just like, oh, this study showed this amazing thing, and it's actually a garbage study,
right?
Which some people do. But then relating, okay, like this is how you can actually, get similar benefits, and, that kind of thing. So yeah, some pretty good stuff coming up soon on my show.
That's exciting. It's really interesting, the whole addiction thing. I've interviewed so many carnivores. We did 43 interviews now for the documentary, probably like 200 just on YouTube. But that's been a common thread among those, that whatever their addictions were, obviously most of them was sugar and the standard American diet, but other addictions you wouldn't think of, like gaming or gambling or chewing tobacco. Like I've heard this over and over again, that just like it sounds like I'm hyping up carnivore, but I've heard it over and over again. It's just like whatever addiction they had, it seems to go away. I almost wonder if those addictions are somehow like a coping mechanism because you have all this inflammation, or you're kind of slowly poisoning your body or something. I don't know what it is, but it's interesting.
It's tricky. I think there's probably two reasons that really come to mind, and there's not a lot of evidence to support this, but it's very widely reported, and I certainly saw it with myself. I think the number one reason is probably a dopamine issue, and carnivore is just a very, very low dopamine diet, and that feeds back then into other dopamine activities, and which addictions tend to be very high dopamine activities. And then probably the second thing is just copium, basically. Just people just in pain, they're inflamed, they just don't feel good, they feel sluggish and lethargic and tired. And so anything that gives them that kind of hit of dopamine, it probably comes back to dopamine, is going to make them feel better when nothing else does. And so again, it's going to promote those addictions, because at least there's something that kind of feels good in the moment when all they feel is just pain and inflammation. So again, it probably helps in both of those ways. But I think really primarily it's probably a dopamine issue, and carnivore is just a very low dopamine diet.
Interesting. It's so nice not having any addictions. Whatever the cause is, like I don't think right. I don't think a lot of people do carnivore because they're like, I want to get rid of all these little, even just minor addictions, like I don't know, playing video games, or not to say those are minor, but gambling, just little things you do here and there. But I don't know, when you have that free will, there's something. Those addictions kind of steer you in one way or another. So it's nice to have them gone. But we're getting near the end of the hour. Do you have just a couple more minutes?
Yeah.
Okay, just a couple more, just like two more questions popped in here real quick. Kerry or Dr. Suresh, any evidence of carnivore for primary hyperaldosteronism? I don't know if I said that correct or not. Down from 4 BP meds to just aldosterone blocker. Looking to get off that too. Thoughts?
Yeah, so it's probably something like spironolactone, I guess they're maybe taking, which is an aldosterone antagonist and aldosterone blocker. So primary hyperaldosteronism, you just get these really high levels of aldosterone, which often gives, really high blood pressure. Not sure what that noise is, maybe a plane overhead. Sorry if you can hear that. And I'm not aware of any like real hardcore like research that's really looked at this, like a ketogenic diet, and certainly not carnivore, into hyperaldosteronism. But I have got one patient with primary hyperaldosteronism, and through essentially a pretty carnivore adjacent diet, they have managed to reduce their blood pressure quite significantly, to the point where we are thinking about bringing them off that one medication that they're left on. And they're super cautious, and their like renal physician is just like, oh my God, you can't ever stop this medication. But we kind of like collectively, like the patient and I, want to maybe just try it, monitor closely, keep an eye on the electrolytes, keep an eye on the blood pressure, and just kind of see what happens. Because that spironolactone, the aldosterone blocker, is also blocking their testosterone and reducing it down, which is then causing subsequent issues. And so it's like, do we go on to TRT to fix the problem with the testosterone that the aldosterone is probably causing, or do we just try and then stay on the aldosterone, or do we try and reduce the aldosterone, stop that, and then see if the testosterone improves naturally, which would of course be the preferable way to do it. But he's been taking this medication for like, I think 10, 15 years. And his renal physician's just like, you have to take this forever. And so he's like, he's a bit cautious, but his blood pressure certainly has reduced significantly on the carnivore adjacent, basically, diet, for ketovore diet. Yeah. So I think it's certainly something to look at.
All right. Good stuff. Hey, just real quick, I got to shout this out. I see Ashley in the chat. I almost forgot to mention this. We've got a big meetup coming, and tickets are almost gone. Dr. Kiltz is going to be there. Bella's Steak and Butter Gang. Laura Spath is going to be. We've been doing these, Dr. Suresh. It's been a lot of fun. We just did one in the UK, Inspiring Carnivore Stories. Yeah, individuals just get up and share their story. Well, here we got individuals, and Dr. Kiltz is coming too. He's incredible. So there is, let me see. There's a link in the description if anyone's interested. There's just a couple tickets. It's going kind of quick. And then we have one the week after that in Chicago with Dr. Kiltz and Dr. Lisa Wiedemann and Dr. Tony Hampton. And we'll have to get out to your neck of the woods, Dr. Suresh, sometime. And you're in Australia, right? Are you originally from the UK?
Yeah, originally from the UK. We've been here for 7 years now. But yeah, based in Brisbane. And just with like my family, 4 kids, it's pretty hard to just travel around. And so
right.
If you come to Brisbane, let me know.
Yeah, absolutely. I really enjoyed our time in the UK. It was I really liked it. It was weird. Like I said this before, but it made me realize how hyper intense the US is in terms of junk food around every corner, and you turn on the TV and it's like pharmaceutical commercials. It was a lot more chilled in the UK. Plus the people were just incredible. And I learned a lot of new words like petrol and loo and trolley, all sorts of fun stuff. So yeah, if anyone's interested in joining us at those meetups, I have a link in the description, and I'll throw it in the chat here. And then I want to thank you, Dr. Suresh, for coming on. This has been great. I got to do one more quick drawing here, if you don't mind. Everyone, make sure you go follow Dr. Suresh, subscribe. I've said this before, but I really mean it. I think we got to elevate the voices of the doctors like Dr. Suresh. It's the only way we're going to change things. So if you posted with community, we're giving away a 1-month membership to the Healing Humanity website. Let's see who won this one. Just shoot me an email, homesteadhow@gmail.com if you won. Oh, I was going to say me. Andrea Prophet. Andrea Prophet. 1 month, Homestead How. Thank you so much. Let's see here. Put this away. All right. Good stuff. All right. Oh, there's one more. Taco fillings. Love the jerky video. I'm proud of you, amigo. No mas fast food carnivores unite. Thank you for that super chat. I appreciate that. Every penny from that goes to the documentary as well. Thank you so much, Dr. Suresh. This has been kind of I didn't expect to get so many questions. Turbo round.
Yeah, it was really good.
Yeah, great answers. I really appreciate you coming on. I appreciate the time you spent on the Healing Humanity membership site with us too a while back. And open invite. We got to do it. We'll have to have you on again and do another one in the future. So
absolutely. Yeah, happy to.
Thank you so much. Enjoy your vacation. Enjoy your time with your family. And thank you everyone for joining us. Thank you for all the good questions. Really appreciate it. Have a good night.
Thank you. Take care, guys.
Bye.